Feeling a lump in your breast can be scary, but it's important to remember that most breast lumps are not cancer. In fact, the majority of lumps are benign, which means they are not harmful and do not pose a serious health risk. Many things can cause lumps, and most are benign, meaning they are not harmful. These can include cysts, fibroadenomas, and other non-cancerous conditions. Our breasts are made of different types of tissue, and these tissues can change throughout our lives. Factors like age, hormonal changes, and even certain medications can influence these changes. Hormonal fluctuations, for example, can cause temporary lumps or breast pain. This is especially common during menstrual cycles, pregnancy or menopause. It's normal to feel anxious if you find a lump, but try not to panic. Stress and anxiety can make the situation feel worse than it is. Take a deep breath and remember that most lumps are treatable, especially when found early. Early detection and treatment can make a significant difference in outcomes. The best course of action is to schedule an appointment with your doctor to determine the cause of the lump and discuss any necessary steps. Your healthcare provider can offer guidance, support, and the appropriate tests to ensure your peace of mind. Breast lumps can feel different depending on their cause. They can vary in size, shape, and texture, and understanding these differences is crucial for proper diagnosis. Some lumps might feel soft and movable, like a small grape. These are often less concerning and can be easily moved around under the skin. Others might feel hard and fixed to the surrounding tissue. These lumps can be more worrisome and may require further investigation to determine their nature. Common types of benign breast lumps include cysts, which are fluid-filled sacs. These cysts can sometimes cause discomfort, but are generally not harmful. Fibroadenomas, which are solid rubbery tumours, are another type of benign lump. They are usually painless and can vary in size. And lipomas, which are fatty tumours, are also generally harmless. These lumps are made up of fat cells and are typically soft to the touch. These lumps are usually painless and harmless. Most benign lumps do not increase the risk of breast cancer and can be monitored over time. However, certain types of lumps can indicate a more serious condition, such as breast cancer. It's important to be aware of changes in your breast tissue. These lumps might feel hard, irregular, or fixed to the skin or chest wall. They can also be accompanied by other symptoms like skin changes or nipple discharge. It's important to remember that only a healthcare professional can accurately diagnose the cause of a breast lump. Regular checkups and being aware of your own body are key to early detection and peace of mind. While most breast lumps are benign, it's crucial to be aware of any changes in your breasts and seek medical attention if needed. If you notice any of the following signs, schedule an appointment with your doctor. A new lump that wasn't there before. A lump that has changed in size, shape or texture. Nipple discharge, especially if it's bloody or clear. Skin changes, such as dimpling, redness or puckering, or pain in the breast or nipple that doesn't go away. These changes don't necessarily mean you have breast cancer, but it's essential to get them checked out by a doctor to rule out any serious conditions. Section 4. Knowing your breasts. The importance of self-exams. Regular breast self-exams can help you become familiar with the normal look and feel of your breasts. By doing this consistently, you can establish a baseline of what is normal for you. This can help you notice any changes early on. Early detection is crucial because it can lead to earlier diagnosis and treatment, which can significantly improve outcomes. To perform a breast self-exam, use the pads of your fingers to feel for any lumps, thickening, or abnormalities in your breasts and armpits. Make sure to cover the entire breast area, including the armpits and up to the collarbone. You can do this while lying down or standing in the shower. The key is to be thorough and consistent in your approach. Look for any changes in size, shape, or texture, and pay attention to any pain or discomfort. Changes in the skin, such as dimpling or puckering, should also be noted. While breast self-exams are not a substitute for professional medical exams, they can be a helpful tool for early detection. Always consult with a healthcare provider if you notice any changes or have concerns. Section 5. Your health, your priority. Seek professional advice. Remember, your health is your priority. If you find a lump in your breast or notice any changes, don't hesitate to schedule an appointment with your doctor. Early detection is key in treating breast cancer and other breast conditions effectively. Your doctor can perform a clinical breast exam, order imaging tests if needed, and provide you with personalized advice and treatment options. By being proactive and seeking professional medical advice, you're taking control of your breast health and ensuring your well-being.